Hello, I'm the oral and maxillofacial surgeon, Dr. Brown. Hi, I'm a surgeon too. Really, what is your surgical specialty? I am a periodontist. Oh Jesus. A what? Periodontist. I perform surgery on the gums. Surgery? I didn't realize cleaning teeth was a surgical procedure. I often lay flaps to complete scaling and root planing. It is a very delicate procedure. I can perform many surgeries. Say a patient has a 5 mm pocket due to chronic localized aggressive periodontitis, I could lay a flap and perform guided tissue regeneration by placing demineralized freeze-dried bone, PRP, and eye of newt. And presto! We get back 0.2 millimeters of bone. Do you realize how much clinical attachment that is? Definitely sounds like you are saving lives. I was in the OR for 6 hours last night repairing a panfacial fracture. What other kinds of big procedures do you do? I spent 3 hours traumatically extracting a tooth last week. 3 hours? I extract 4 wisdom teeth in 30 minutes. How does it take you 3 hours? Well, first we must carefully elevate the tissue. Then we must section the tooth into 30 different pieces and carefully elevate each piece out. We wouldn't want to lose any cortical plate. Actually, I wanted to talk to you about collaborating on some big cases. Why would I want to collaborate with you? Do you even have OR privileges? Well, I think there is a lot we can learn from each other. While you may be the best at moving jaw bones, I would argue that no one moves within the jaw bones better than us. What the hell does that even mean? I have a patient that needs 30 implants. Her ridge is deficient. She has generalized 50% bone loss. I need you to do a hip graft so I can place the implants. 30 implants. Are you freaking kidding me? I thought you were a surgeon. Why can't you place the hip grafts? I'm a surgeon. I will place the 30 implants and the hip graft because you claim to be a surgeon. I'm going to place 30 implants, right? Okay. Fine, since I'm assuming all the risk, please tell me the patient's medical history. The patient is a 54-year-old male with PSRs of 3, 2, 3, 2, 2, 3. I initiated full periodontal charting and found generalized 50% bone loss with bleeding on probing in all 4 quadrants. Multiple teeth exhibited +3 mobility. The gingiva is erythematous and rolled. There is a loss of stippling throughout. It exhibits a thin biotype. The low plaque-free index was 50%. The patient's oral hygiene was poor. Multiple crowns in the upper right quadrant exhibited biologic width violation. I think with an apically positioned flap and osseous recontouring we can restore the biologic width. That is not a medical history. Jesus. Is the patient taking any medications? I've placed the patient on Periostat. I have also placed a perio chip in vertical defects around 23, 27, 30, 15, and in 15. I injected Ariston in the pockets of 12, 13, 32, 16, 1, and 8. I hope to gain more clinical attachment from these local measures. I'm going to slap you if you don't stop talking. Modified Widman flap distal wedge. I'm going to stab you in the eye with one of your stupid perio probes. Oh, I can show you how to use that. You call yourself a surgeon? Your life is a disaster. And your specialty is a joke.